is a high incidence of ACL tears that we see at this clinic, and so today I wanted to go over some things that put you at risk for this injury and ways that you can decrease the chance of getting them. We see it a lot in younger athletes, but it can happen to anybody, really, and we see it more often with females, and I'll explain to you a little bit why. So if you can see where I put the tape on my legs, there is a natural curve that occurs at the knees. Typically, that's normal. We see a fair degree of it. But what you don't want to see is an increase. So if I move my knees more together, you'll see how that bend really accentuates. We don't want to see that. That puts you at a much higher risk. So a couple of the things that can cause that, if you have hip weakness here and you can't support that leg, so whenever you stand on that side, you see how it can kind of go in that way? That can cause that valgus deformity a little bit. And then I can show you too, if I collapse my foot like I don't have an arch, it's naturally going to pull that arc in a good bit as well. So because the hips and the ankles are such a good component for stability, put you at really high risk if you're not strong enough at either one of those joints. The most often time that we see these injuries occur are with landing events. So anytime that somebody comes down, if whenever they're down, their knees come inwards, that's a really bad sign. So anytime that we're training kids, anytime that you're training yourself, if you're weightlifting, anytime you're going down into a squat, you want to make sure that your knees stay over the toes. If whenever you go down, you feel this, you want to strengthen here to pull it back out again. And anytime that you're landing, especially jumping volleyball players, whenever they land, we see that often. Anytime that you're cutting, so if you land really hard and you're trying to push off this way, you want to make sure that that knee isn't here while you're pushing off. You want to keep it right over the foot itself. Okay. So there are some programs that we can develop to help decrease your risk of an ACL injury. The main thing that you want to remember is before any practice, before any game, you want to do a really good warm-up. You want to do some stretching of a lot of the muscles in the lower legs, and then you also want to do some agility drills. Following that practice or that game, you also want to make sure that you do some strengthening techniques, and then you want to follow that up with a cool down. There are many different ways that you can do this. The best way that I would recommend is to talk with either an athletic trainer or a physical therapist. You can come in and we can help you to develop that program yourself, and then it's something that you can maintain to decrease that risk overall.